There we go.
President, my name is Teresa Morrill, and I just want to say that I'm really excited that you're here in Cannon Falls. And my question is there something we can do about the rising cost of prescription drugs? And number two, if you can't legalize marijuana, why can't we just legalize medical marijuana to help the people that need it?
Well, you know, a lot of states are making decisions about medical marijuana as a controlled substance. The issue then is, you know, is it being prescribed by a doctor as opposed to, you know, well, I'll leave it at that. With respect to prescription drugs, the prescription drug program that now is part of Medicare obviously has been very helpful, but the costs had been going up and up and up. So part of the Affordable Care Act, health care reform, also known as Obamacare. By the way, you know what? Let me tell you. I have no problem with folks saying Obama cares. I do care. If the other side wants to be the folks who don't care, that's fine with me. But yeah, I do care about families who've been struggling because of crushing health care costs. I met a young man here who, right here, who, as a consequence of health care reform, you know, he's got a blood disorder that if it weren't for the Health Care Reform Act, his family would have been capped out. And he wouldn't have the help that he needs. And you can tell he's an outstanding young man and he's going to do great things, and his family's not going bankrupt as a consequence of it. Now, the same thing is true on prescription drugs. What we did as part of the Affordable Care Act was we said, first of all, we're going to give a $250 rebate to every senior out there who's using the prescription drug plan to help lower their costs a little bit. And what we've done is we're starting to close what's called the donut hole. And for those of you who aren't familiar with the donut hole, the way the original prescription drug plan was structured, you would get some coverage up to a certain point, a couple $1,000s. Once you spent a few $1,000s, suddenly it just went away. And you were on your own out of pocket until you got on the other side where you'd spent many more thousands of dollars, and then you would get a prescription drug plan again. Well, we said that doesn't make any sense. Let's close that hole. And as part of the Affordable Care Act, we will be closing that hole. And we're also making it cheaper for generics to get on the market, as well as brand name drugs. So overall, the Health Care Act should be lowering prices for prescription drugs over the next few years. It's getting phased in, so it didn't all take into effect right away after I signed the bill. It's getting phased in over the next several years. But you should start seeing some relief if your family needs prescription drugs. That was part of the Affordable Care Act. All right?